Namaskar. Some time ago, I had shared in this video channel my experience of a COVID case in my family. My brother had COVID-19 and he was also hospitalized, and it was quite serious for some time. Happily, he has recovered. In that video, I shared my experience of the entire 3 weeks of what happened in the hospital, what I saw, and what was happening in my social environment in the villages where I live in rural India. And I instinctively felt at that time that it is very important to address this question of anxiety and fear and neurosis, paranoia, whatever we may wish to call it. And I felt at that time that this is contributing to the cases getting more serious. This is what I felt. A study has just come out, a week or 10 days ago from the USA, and that study actually lists anxiety and fear-related disorders among the top 3 contributing comorbidities which contributed to death in the US. It is quite revealing, and let us have a look at the detailed study over the next 5 minutes. This study was conducted by the CDC, the Center for Disease Control in the US, and its study was on the underlying medical conditions and severe illnesses among 540,000 adults who were hospitalized with COVID-19 between March last year and March this year. So this is an exhaustive study over 1 year of every person in the US, adult, who has been hospitalized with COVID-19. Now, the study does not reveal whether all these patients were admitted after they got COVID, or it included people who were already in the hospital and who were later detected with COVID-19. That is not clear. But the fact that it has 540,000 adult patients whose entire medical history, medical condition, and treatment all has been methodically recorded. And this analysis, therefore, is of great value to us. Incidentally, at that time, or should I say during that period of 1 year, more than 5 million Americans were in hospital. So 4.5 million of those hospitalized were there for other conditions, not to do with COVID. So the COVID hospitalization cases over the last 1 year has accounted for 10 to 11% of the total hospitalizations in the US. I'm giving the statistics because it's very relevant to the subject of discussion in this video, that we should understand the scale and not imagine a larger and more expanded scale of the virus effect than it actually is. Now let us have a look at the part 2 of the study. Among these patients, some had 0 comorbidity, some had 1 comorbidity, some had 2 or 3, and some had as many as 10 comorbidities. Now, what this study shows is that of all the people who died of COVID and the other complications together in that study, only 0.9% of the deaths was accounted for by those with 0 comorbidities, which makes sense, which is obvious. If you don't have any comorbidity, it is best, safest for you, and there is least chances, least risk of death. Now, only 2.6% of all the deaths were accounted for by those with 1 comorbidity. So even if you have, say, just one problem, say diabetes, or you have hypertension, you still stand a very, very good chance of being almost as on par with the risk with a person with 0 comorbidity. Then suddenly it changes the statistics. It shows that for people with multiple comorbidities, say 2 to 5, people who have a combination of morbidities, suddenly the percentage, the risk percentage really rises. And among those who died in that group, 32.3% of all the deaths was accounted for by those with multiple comorbidities. Now, which of these morbidities proved to be the highest or the strongest risk factor for death in this study? We have this in the form of a ratio called the adjusted risk ratio, where a figure of 1 means the same risk as any other patient without morbidity. And what this study shows is the highest risk factor for death was obesity with a scale of 1.3, which means people with obesity had a 30% more risk of dying than others. And second on the list, which is the reason for this video, the purpose for this video, and for some, so that we get some learnings, is anxiety and fear related disorders. Now these had a scale of 1.28, which means people with anxiety and people who were really fearful had a 28% more risk of dying than others. Third on the list is diabetes with complication. Fourth, chronic kidney disease. Fifth, neurocognitive disorders. And sixth, COPD, chronic obstructive pulmonary disease. Now, along with this top of the list items, there are also bottom of the list items, which means comorbidities which are not so bad, if we can put it that way. And it's important to know those so that we don't have a distorted idea of the risk factor associated. In the bottom of the list are 1, diabetes without complication. As I said before, diabetes with complication is a different morbidity. Diabetes without complication is on the lowest 4 in the list of morbidities in the risk factor assessment. Another one is essential hypertension. The risk factor is hardly anything more than any other person with no morbidity. That is a very important learning from this. And then there is disorders of lipid metabolism. Again, that did not contribute to rising the risk factor at all. Or even asthma. Don't you think this is, in a strangely logical way, we would have thought that people with asthma who anyway cannot breathe would be most severely affected by COVID-19, which led to breathlessness, but it is not so. No doubt this study is so revealing. It is so informative, it is so useful, and it points us in a better direction in terms of how to look at this entire crisis. It also gives us tips which are obvious, but it is good, when a study reinforces that which we already know, especially about obesity, which in the US I'm told is a serious and well-known and a decades-old problem. And if that is handled at a different level, then the COVID crisis can be much lesser. And there is also lessons about the false alarms. Anyone with diabetes and hypertension, these were the two mentioned in the media every day last year. And considering that there are millions of people with higher blood pressure who are taking daily tablets, and they were all getting fearful. And now we know that those morbidities, if the rest of the health is all right, are hardly raising the risk factor. In fact, if they caused anxiety and any fear-related disorders, that would increase the risk factor to a very high level and actually lead to your illness becoming very severe. Very, very good learnings. And on the anxiety front, if I may share with you that earlier video which I did narrating the experience of my brother in hospital, I actually observed in my society, in my village community in rural India, how people were panicking. They must be getting it from somewhere, the local media, the social media is everywhere now with mobile phones, through local newspapers who were copying what the bigger newspapers were saying, which were imitating what and just rehashing what the foreign newspapers were saying. I think down the line, from the WHO, from the CDC, from the FDA, which the whole world follows, which is why I keep talking about the American system. It's like a big brother, which is being followed by everyone. And by blindly following it, even our own scientists, by blindly just rehashing whatever they said and feeding it to us, not considering with a fresh mind what our society, our environment, our needs were. I think this has led to a huge rise in anxiety and fear related disorders. Apart from the media's fear mongering and the medical institutions fear mongering, and the pharma industries obvious joy at people getting fearful and dying for a vaccine. That aside, there is a second thing. I think statistics has misled us. I think we kept right from the beginning, right from the China stage, we kept talking about case fatality ratio. If there are 100 cases which we have detected, how many went to hospital? That is a hospitalization ratio. How many of those died? That is a case fatality ratio. But that, over a period of time, everyone now knows that that is wrong. Because for every 100 cases which you record, there are 1,000 more cases in society happening. And those people they're not reported, they're not part of the statistics, but they've had the infection, maybe without any symptoms, maybe with mild flu-like symptoms, and they are all right. In fact, they're not just all right, they are now naturally immune and will not get COVID or any of its newer strains easily. We studied this in the previous video. If you have not seen that on natural immunity, I'll put a link in the description below. So now what we have to move towards and understand is not case fatality ratio, but infection fatality ratio. How many among those infected in a community are getting serious and how many are getting hospitalized, how many are dying? Isn't that logically and the most sensible thing to look at? But instead we were stuck with this case fatality ratio, and leading doctors and institutions are to be blamed for spreading this thing, and also for predicting that the fatality ratio of this disease will be 10 times that of influenza, 25 times that of influenza. But that is not so. Now that seroprevalence studies are regularly being done in communities all over the world, let me share with you a study which has been published both by the WHO as well as the NIH in the USA. This study involved a collation of 61 diverse seroprevalence studies done across 51 locations all over the world. The findings of this study is that the median COVID-19 infection fatality rate is 0.27%. Yes, 0.27%. The authors also write in their conclusion that the inferred infection fatality rates tended to be much lower than estimates made earlier in the pandemic. In India, we have serology studies saying that 750 million people, or more than 2/3 of this population, have already had the infection. Okay, and they are now naturally immune. And therefore, if you take the deaths, I know many people in the world, even in India, are disbelieving of this death figures. So let us double the figure of deaths. Even if we double it, then the infection fatality ratio comes to just 0.1%. I think this is food for thought. One, about this huge US study over 1 year with 350,000 patients, showing that anxiety and fear related disorders really increase the risk of the disease going severe and leading to more breathlessness and more ICU care and intensive care and death. And now combining with the other statistics, that we have to reorganize. Instead of the case fatality ratio, we have to look at infection fatality ratio. And actually, it is not so bad. Now to conclude, let me add, neither me nor people in this group I know are extremists. We are neither the medical extremists who will only listen to FDA and WHO and Fauci and not question them. We are not like that. Neither are we extremists on the other side who say to hell with science and we don't believe in disease. No, we are in favor of science, but we are in favor of open, transparent science, and we are in favor of people, especially institutions and governments, accepting their mistakes and sharing the real truth with us. And we are also we are in favor of being careful. We are in favor of being aware. Awareness is a different thing from a panic-stricken neurosis. It's totally different. And awareness means you have a calmness in your mind to be able to see things. And we can take care, and we have to take care in this pandemic. But what this fear mongering in the media has done is something else altogether. Some very good lessons to learn, I thought, and therefore I'm sharing it. As usual, I'll put some of these links in the description for those who want to see, and also links to some earlier videos for those who are visiting this channel for the first time. Thank you very much. Stay healthy and stay happy.